Hi, this is Dr. Welch. The course is OTC2, and this is dietary supplements for weight loss.
So there are a ton of dietary supplements out there on the market today for weight loss, and we don't have time to go through all of them. So I want to focus your attention on a few of them. So let's talk about these. And green tea, Hoodia, and raspberry ketone. Now, I mentioned Hoodia as while I was going through the Finding Reliable Dietary Supplement information. So I would refer you to that presentation so you can pick up some of the information about Hoodia. So we won't cover that today. Instead, we'll focus on the other two. So what's important with the dietary supplements? From my perspective, I think you as a pharmacist should know what the common uses are for these products, and you should have a good sense of the evidence that supports that use. So we're going to talk about that. I also think safety is important. I think safety can come in really one of two areas, adverse effects and potential drug, herbal, drug supplement, drug food interactions. We'll just say interactions as a whole. So you need to know what these products are commonly used for and if they're going to cause any harm if patients were to take this. And then any other unique or pertinent information that may come up with a particular product. So as throughout this semester, as I go over dietary supplements, these are kind of the things that I think are more important, and this is what I would be holding you accountable to. Because I think at a minimum, you as pharmacists should know this information and then know where to look up some information that may not be as common. So let's start with raspberry ketones. Well, what do we use it for? The indication weight loss. And if you recall from finding reliable information, I looked at the Office of Dietary Supplements, which is a part of the NIH, and I put some quotations there about what they found. They say it may help prevent weight gain by altering lipid metabolism. However, there's little evidence to support that claim. So it gives you a sense of people are using it, but is it really working? The evidence suggests it may not be. So let's look at that evidence. And what they actually did, I pulled the article. It was published in the Journal of International Society of Sports Nutrition in 2013, and it looked at 70 people. Now, it's important to know that only 45 of those subjects completed the study. If you look into the study, they did account for everyone. Some people were lost to follow-up. Some people had poor compliance with the study protocol. So that was a good thing that they justified the rest of the folks. But this study compared the product Metabo versus placebo in patients taking it for 8 weeks. And what they found was that Metabo patients had a 2% reduction in their body mass, and the placebo had a 0.5. So the difference between the two was significant. They also looked at fat mass and the waist girth and hip girth, and they found statistically significant improvements in the Metabo group. When they looked at safety in this particular study, they noted that there was no changes in the blood chemistry over that 8-week period, so their lab values didn't change, and they didn't have any adverse effects that were noted in that particular study. So this is one small study, 70 people, that showed significant improvement. Now the question is, what is in Metabo? And they actually provided that in the study. And Metabo does contain a proprietary blend. That's the pro-grade metabolism that you see there. And if you recall from previous presentations and class, that they only need to notify you of the total amount of that proprietary blend, and they just can tell you, list the ingredients underneath it, but they don't have to tell you what percentage is in there. So raspberry ketone is one component of that blend, but it's not necessarily the the only component. So is it the raspberry ketone that led to the 2% reduction in weight? Is it the caffeine? Is it the bitter orange, the ginger? Nobody knows for sure. So you can't really draw out raspberry ketone as the weight loss agent when it could in fact be this proprietary blend, at least according to this study. So now let's look at green tea. Green tea has many uses. It enhances mental alertness. It contains caffeine and it's tea, so obviously there's an assumption that the caffeine is contributing to that mental alertness. It actually has an FDA approval topically as an ointment, the green tea extract for genital warts. Um, it has been studied for use in cancers, certain types of cancers, and it really hasn't had any good beneficial effects. It has some limited evidence that it may help with heart disease and some of the risks associated with heart disease. It has not been shown to produce any meaningful weight loss. We'll go into that. So weight loss is another indication. And lastly, there's been some concerns with its adverse effect profile as far as effects on your liver and effects on iron and iron absorption. The NCCIH is actually funding studies right now to look at that. So it sparked the interest of the government, and they're beginning to fund studies. So let's look at the evidence. Well, there was a Cochrane review done in 2012 that looked at all the evidence for green tea for weight loss. And in this particular review, they had to separate out the studies a little bit to find some consistencies within them. So they looked at studies that were done within Japan and studies that were done outside of Japan. And if you look at the 8 studies within Japan, they looked at over 1,000 people. Those studies weren't able to be combined to pool the data. So in other words, when you do Cochrane reviews, the idea is that you look for studies that are similar, and then you sort of combine the results and make a more informed decision or statement about the results. Well, they couldn't quite do that. The studies weren't similar enough. So they did present some of the ranges of weight loss that was found within those 8 studies. And anywhere from 0.2 to 3.5 kilograms were seen within those 1,000 people. Well, then they looked at the 6 studies that were done outside of Japan, and 500 people were part of those samples, and they were able to pull these data together, and they found that a mean weight loss of negative 0.4 kilograms. Now, if you look at the range statistically, it was not significant. It ranged from either losing weight to even gaining weight, so they couldn't show any statistical significance. So their conclusion, the author's conclusions from this Cochrane review, this global review of the evidence that existed at the time in 2012, they said that green tea appears to induce a small weight loss, but it's statistically insignificant in people who are overweight and obese, and it wasn't able to maintain any clinically meaningful weight loss in those people. So let's look at the safety profile of that. Well, if you consume green tea as a beverage, there hasn't been anything reported. People drink it, no adverse effects reported. If you're consuming the green tea extract, this is where the case reports have popped up over liver damage. So much that the United States Pharmacopoeia reviewed those case reports, and they published that in 2008, and they found that of the 216 reports, 34 of them had some link to the green tea. 27 of them they ranked as being possible, that green tea was a possible cause of the liver damage. And in 7, they sort of elevated that association and said it's a probable cause. So there are some case reports, and as I mentioned before, the government is funding studies to look at this a little bit further. They did go on to say that there's a chance that maybe there was some contamination in these extracts. They weren't standardized, and that maybe that has something to do with the damage that was seen to the liver. So in any case, if you're recommending green tea extract to your patients, you can expect insignificant but small, modest weight loss. However, you run the risk for liver damage according to the evidence. When you look at drug interactions, green tea contains caffeine. Caffeine would antagonize the effects of sedatives and benzodiazepines. So if you're looking for calming sedative effects, caffeine is going to do the opposite. It also may inhibit the metabolism of theophylline. So green tea, by nature of its caffeine content, can have that interaction. Green tea as a leaf contains vitamin K. However, when you turn it into a tea in a beverage, you lose a lot of that vitamin K content. But vitamin K has an opposite effect to what warfarin does. It tends to oppose that and antagonize that. So adjusting warfarin doses when consuming green tea would be a good thing. And there may be some suggestions that this inhibits iron absorption. So those are some dietary supplements for weight loss. Thank you for listening.